And it's A Leg Up with Dr. Randall Julef from the La Bella Vita Laser and Vein Center. The podcast about how you can keep your legs healthy and strong so you can put your dancing shoes on. I'm Spud McConnell here with you and Dr. Randall Julef, so let's get right to it. And so here we are, Spud McConnell, your host, as we talk to Dr. Randall Julef on the pilot episode of A Leg Up here with La Bella Vita Vein. And what's all the fancy? Because you got a big, long title with the name of this place.
Yeah, it might be too long, Spud, but we call it La Bella Vita Laser and Vein Center because we treat vein care. We do vein care, and
which a lot of people don't even think about. It's like vein care. What's that? I take an aspirin, I'm good.
Right.
It don't work that way.
Well, that's one conversation. How do people know that they have a vein problem? Because there's a lot of people out there that don't know, because there's a whole slew of different types of symptoms that people might have that are related to poor vein function. Sometimes it's obvious, often it's not. I always say to people that, if somebody has varicose veins, that's easy. Yeah. They know, I have a vein problem.
The spider veins.
Or spider
the
veins.
big bulgy things. Yeah.
Yeah. But there's a whole host of other symptoms out there that people might have if they have poorly functioning veins. And often, I would say most of the time, they don't really know that they have it. So they don't know what to do about it or where to go to have it looked at.
Well, I'll tell you folks how I got to meet Dr. Julef was talking about this vein center. And y'all did the ultrasound on my legs.
Yeah.
And I got to tell you, Dr. Julef was a little surprised that my veins were as good as they were, because if you took a look at my splotchy diabetic legs, you just go, man, forget about it. But no, and I don't have, other than an occasional cramp, and then I eat a couple of bananas and that goes away. But, ever since y'all done that ultrasound on my legs, man, I'm doing good. I'm doing pretty well. But it was nice to know I didn't have anything wrong with me, so I don't have to worry about that.
Right. Well, and often that is it. Often people come in and they have symptoms and they don't know what it's due to. And we check out their circulation, let's say, because we can, not only do we evaluate veins, but we evaluate arteries, and there's other stuff called lymphatics and this kind of stuff. So, we can check all of that out and narrow things down. And sometimes, like yourself, we find that person doesn't really have a circulatory problem, and we try to help them get to another specialist or whatever they need.
Because because we're going to go over the symptoms that you were talking about, and somebody may have some of those, but a lot of symptoms are to a lot of different things. You can have something that sounds like an obvious vein problem,
right?
And it's not. People have a headache, and the next thing you know, it's because they got a pinched nerve in their back.
Yeah. Well, and you were one of those people.
Scared you, didn't I?
You really threw me off that day, Spud. But no, you had two things: chronic swelling.
Mm-hmm.
And you also have the discoloration of the skin of the lower leg. And most of the time, both of those things are due to poorly functioning vein. Now, especially the swelling. Swelling can be caused from a number of different things. So sometimes it's not only what we call venous insufficiency. When the veins aren't working properly, we call it venous insufficiency. But often there might be a couple of different things that might be causing swelling. But those are two very, very common symptoms of venous insufficiency, swelling and discoloration of the legs. You had both of those, and I was surprised that we didn't find it.
Mine turned out to be meniscus tears in my knee and fluid that way. But it's like, but now I know what it is, so I'm not sitting here fretting over my leg, because they got those brown splotchy. I thought it was sunburn, because I used to drive all the time without wearing short pants, and it's like, so it was good to know this stuff. And what surprised me on that visit where you did the ultrasound on me is that it's cool how that machine works, because you run the thing up the side of my leg. but it's looking like down your leg at the vein. So that's like some Buck Rogers stuff, you know. How the hell do you get a machine to do that?
Yeah. Well, that's our ultrasound machine, and we use ultrasound pretty extensively to look at blood vessels, and we can look at both arteries and veins. Mm-hmm. We can look at a lot of different things with the ultrasound machine. And the ultrasound machine, it's been with us for 50 plus years, but the technology behind the ultrasound machine just has gotten better and better as the years go by. And I mean, just, it's always getting better. I remember the ultrasound machines that I used when I was starting to get into this business, and the technology that we have today is so much better. But the ultrasound machine is great because it's just, putting a probe on your skin.
It doesn't hurt at all.
Completely non-invasive, completely pain-free. And it gives us a tremendous picture. Not only does it tell you about the flow characteristics that we see in a blood vessel, but it also gives us a nice picture, and then we can add color, and it's a great thing. And I think a lot of people, when they get pregnant, women, they're having a baby and they do an ultrasound, and I think often couples are, tremendously surprised at how much delineation and definition.
Yeah, really.
That ultrasound machine, gives them.
When my wife was pregnant with our youngest, they were concerned because we got married in our late 30s, so she was well over 40 when she had our last. And so they put the ultrasound on her. And it was so funny because it was like she was swimming around in there. Mm-hmm. And because they wanted to take a sample of the amniotic fluid. So they waited till she was on one side, and then they stabbed her with the needle. And I mean, you could see her head look up and turn and start swimming towards the needle. They go, pull it out, what these things are capable of doing is it amazes me. Like I said before, you're doing down the side of my leg, but it's like you're looking from the knee down. Do you get questions from the manufacturer of these machines about how you use them and maybe what would be better for you so that the next person you get to diagnose, you have an upgraded machine? Like over the last 50 years, how far have they advanced?
Quite a bit. And is that due to response and the opinions of various people using those machines and responding to questions? Sure, absolutely. And they get that information in one way or another. Usually these medical device kind of companies, they have their reps, and so we're interacting with them. We're not necessarily interacting directly with the technicians that are coming up with these things. But I think they respond to needs. If a group of physicians is saying, "Hey, we really need this ultrasound machine to do this," then they're gonna come up with a way to do that.
It is mostly a software type of thing. I mean,
it is.
I'm sure they're changing the actual sound waves that go in there, how they focus them, and things like that.
Right, and it's a computer like anything else, it's just interpreting sound waves, like you said. But the probe that you put on the skin of whatever part of the body that you're looking at, the probe is a very complicated thing, a very complicated device. As a matter of fact, in many systems, the probe itself is probably nearly half the cost of the whole machine.
The whole machine. Because it's like Flipper, because it's sending out a sound wave and reading at the same time.
Right. Yeah. And in just, the level of definition and what it's looking for, not only does it give you a picture, but it also gives you a sound kind of response to what's happening within that blood vessel, which in and of itself is very, very helpful, depending on the waveforms of the sound that's being emitted.
You told me something that I didn't know. The arteries push the blood out, the veins push the blood back. Well, I wasn't thinking about that, but you told me about these little valves that are inside your veins that actually, every time the heart pumps, it shoves the blood back up, but then these little valves close so that it can't fall back down. And I found that kind of fascinating because, these are things you never think about. I don't think about this guy. I'm thinking about paying my mortgage.
Right.
But there's all these little things that you need to understand. And when you see, and then you showed them to me on the ultrasound, it's like, damn, that's like a miracle of creation. I guess I don't want to get into that part of it, but how do you, well, how do you find that stuff out in medical school on a cadaver? What do you look at and go, oh, what is this little valve right now?
Well, dissection and anatomy and all that stuff is certainly at the crux of starting to understand all that. But it's interesting that you bring up the valve issue, because the valve issue within the veins is really the crux of the problem when people develop vein issues, when they develop this thing that we call venous insufficiency. You mentioned the heart. Now, the heart pumps blood through our body for sure, but the heart is pumping blood through the arteries. So heart pumps, blood moves, through the arteries and goes to the entire body.
Mm-hmm.
Blood, then it goes to the body. It goes, through the little capillaries and arterioles and venules and all those tiny little blood vessels, distributes oxygen, and then starts on its way back. So veins bring blood back to the heart. Well, blood in veins is not moving because the heart is pumping. Blood in veins, especially in our legs, the blood is actually being pulled downward because of gravity.
Which is the little valve.
So there's two reasons why the blood in veins will, move back up toward the heart. And the valves are very, very important, but just muscular activity too. So when we walk or contract our muscles.
Okay. I'm understanding. This is why when somebody has surgery and they're laid up in a hospital bed,
mm-hmm.
you put those things on them to make sure that the blood compresses, because that's how they're going to get a clot, because they're not doing anything to help those veins push the blood back.
Right. Yeah. If the muscles aren't contracting, then the blood in the veins, especially in the legs, becomes stagnant. It doesn't move, and that's what puts them at high risk for blood clot formation.
Because there's more blood being forced through the arteries, but these things aren't doing their share, bringing the stuff out the way.
Right. And the other analogy, or the other, kind of scenario there, is that when people are standing, when you got a bunch of military guys standing at attention for
mm-hmm.
a long period of time, or you're at a graduation or whatever, Easter Sunday in church. When you're standing upright and you're not moving around, your muscles are not contracting, and the blood is settling down into the legs. Now, even if the valves are working properly, if you don't have that muscular contraction, the blood's not going to move. And so that's why, in the veins in our legs can hold a tremendous volume of blood. And that's why people pass out after they're, standing up for 30, 45 minutes and not moving around, because all that blood is
everybody thought it's because their knees were locked, but that's not it.
No, it's lack of blood flow to the brain, because the blood is now all down in the legs.
That's interesting.
Yeah.
How long did it take you to learn all that kind of stuff? Because I knew you were a heart surgeon before, but you moved into this field. Yeah. How long does it take you to become somebody who can become an expert in venous insufficiency and all the stuff we're sitting there talking about?
Well, I think, a lot of people will say to me, gee, you did, open heart surgery and vascular surgery for, 15 years or whatever. And then now you're doing just veins. They say, why, number one, and number two, why did you take that circuitous route? But, it's all been very, very helpful. I don't in any way, shape, or form feel like I didn't benefit from all that prior study. Veins are just blood vessels, and I've always worked with blood vessels in one way or another. Even when I was doing cardiac surgery, we used the veins in the legs for the bypasses, in the heart. Or we were doing, surgery on the arteries and use the veins, or, so it was always a part of, what I was doing. And, it's been a tremendous learning journey to where I am right now. And, I love this stuff. I love veins.
I know. I've had many conversations with you, and this one is a little more extensive than most of the ones I had. We did talk one of the first times I met you about, like you just talked about, taking veins if you got to do a replacement. What happens when you lose a vein? I mean, if the veins are that important, number one, veins have those little valves in them. Do arteries have those little valves? And why can a vein substitute for an artery? And then what happens to the vein if you have to take one out of the leg and use it somewhere else?
Yeah. That's another excellent question.
I know all my questions are excellent. Even the stupid ones are excellent.
Well, no, that's not stupid. It's a good question. But to answer your first part, no, arteries don't have valves because the blood is moving because the heart's pumping, and just that pressure head does not allow the blood to go back all that much. Actually, there is a little bit of to and fro movement even in the arteries, but the valve or the veins, they're a blood vessel. Yeah, they're depending on which vein it is. They are sort of disposable. You can get by without them, so we often use it as a substitute. However, your question, the most interesting part of that question is how or why. Why can you do that? Because you have to wonder. Well, there are valves in those veins, and so the blood is only going to go one way. What if you've got the vein, in the wrong direction? And,
Now, I was saying, I mean, suppose you attach it, and then the veins are up. I mean, the little valves are up, and it's now fighting to go through there because they're blocking the way.
And when you're substituting a vein for an artery, you have to contend with that. You have to we do one of two things. We either reverse the vein, and we call that a reverse saphenous vein graft. And so you reverse it so that the valve is no longer impeding flow. It just kind of opens.
So you're going to make sure when you take the valve, the vein, this is the top, this is the bottom, and when you go put it, make sure you invert it. You don't turn it inside out or anything like that.
No.
Can't do that.
Switch one end to the other. Or the other option is that we have these little fine instruments that we actually are able to cut the valve. So if we're leaving the vein, what we call some bypasses, for instance, down the leg are referred to as in situ, and that just means that we're leaving the vein in the correct anatomic position. So if we do that as a bypass, then we have to use this little kind of a hockey stick sort of thing that we go up the vein and actually cut the valves so that now the valves are no longer functional and the blood will flow through.
So you would use, like, if you have to replace an artery in a leg, you're going to take a leg vein and just kind of switch it over.
Right. Yeah.
Okay, I'm buying that. Not that I could argue against you. But the question now is, what happens to the vein that wasn't there anymore? That vein was bringing blood back up. And now this is a whole leg. Do I have to go walk farther every day because I need my muscles to squeeze more blood up less vessels?
Yeah, no. Fortunately, no. The reason that we can, remove veins for other, procedures, or, one of the main procedures that we do for venous insufficiency is called endovenous ablation. We close the vein down. So, and people say, well, gee, doc, am I going to be able to get by without that vein? And I tell them, yeah, you're going to get by better because number one, that vein isn't working. It's not doing you any favors. And number two, and more importantly, probably, we've got thousands and thousands of other veins in our legs that are easily going to take over the work of the vein that we're closing.
I mean, your body just automatically does it.
Yeah, and your body, so let's say we eliminate a vein, and for whatever reason, either for bypass or for because of venous insufficiency, and the body automatically reroutes that blood that would otherwise be going through that vein to normal vein, and then it comes back up to the heart the way that it should. So, and that's why the procedures that we do for venous insufficiency, that's why they work, because the body automatically does that, and it actually improves the overall, circulatory function.
I had a friend of mine who unfortunately had to have a couple of kidney transplants.
Yeah.
And, he told me, I said, what do they do with the old kidney? There's nothing. They just leave it in there.
Right.
And your body eventually just kind of absorbs it and gone.
Yeah.
That sounds like some John Carpenter movie or something like that. It's like going to grow tentacles or something come at you.
Yeah. It slowly gets smaller and smaller, and then
it's just gone.
Yeah, and that's what happens to the veins that we close. The veins that we close, they sort of develop a coagulum inside of them, and then that kind of contracts in the body. Kind of slowly breaks it down over time. And when we look at the veins that we have closed with the ultrasound machine, let's say a year later or whatever, we just see a little thread, a little fibrotic thread where that vein used to be. So.
And what is that? I mean, just an area?
Or it's probably a little remnant of the vein. It's not like the body, breaks it down completely. There's still a little fibrotic sort of thing.
But it's just not doing anything.
Yeah, it's nothing.
Well, this has been an interesting conversation, we're going to have several more of these here on A Leg Up with Dr. Randall Julleff from the La Bella Vita Laser and Vein Center. Of course, the laser part makes it sound like you'll remove tattoos or something. But
we use laser to treat veins.
Well, I want to talk about that, and when we next week when we're on, 2 weeks from now when we're on again, we're going to talk about. Let's get into exactly what venous insufficiency is. And you talked about what are the symptoms. So we'll talk symptoms, what it is, treatment, how effective, all the different kinds of treatments, and what happens if you ignore it. But in the meantime, Randall, it's been a pleasure like it's always been.
My pleasure completely, Spud.
Thank
you very much.
So here we go. Yeah, A Leg Up, a new podcast with Randall Julleff, MD, venous insufficiency, La Bella Vita vein. And I'm Spud McConnell, your host, and we'll see you in a couple of weeks. Thanks for joining us here. Make sure you tune in next time for more information about how you can keep your legs happy and healthy here on A Leg Up with Dr. Randall Julleff from La Bella Vita Laser and Vein Center. See you next time.